My dear learned friends, at the very outset, I must express my deep sense of appreciation and gratitude to the organizers of Dhara Vision event for providing me with an opportunity to share my views with the learned professionals who have gathered here today. I have been asked to speak about the vision about Ayurveda industry in 2047. The healthcare system of Ayurveda has come of age in the past 2 decades or so. I am attempting to project what Ayurveda would be in the 100th year of our national independence. It may also worthwhile to briefly consider what Ayurveda was in 1947 at the time of our independence, as well as what is today after 75 years of our independence. That would be, in a way, provide the context within which we will be able to look at the future possibilities. Before taking a look at the future of Ayurveda, I need to present before you a few observations pertaining to the context. Firstly, I need to make it clear what I mean when I refer to the term Ayurveda industry. It is not just the domain of Ayurveda drug sector. In the present context, I would include the following domains under the general term of Ayurveda industry. One, the domain of healthcare service. This domain will include both the hospital sector for the care of patients and the wellness sector for the care of leisure. To the domain of products. This domain will comprise several diverse sectors, including a sector for classical formulations, sector of medicinal products, which are takeoffs from classical knowledge, the sector of modern pharmacology based drugs, the newly evolving sector of phytopharmaceuticals, the sector of the health aids and dietary supplements, and the FMCG sector for herbal cosmetics. All these sectors together form the domain of the product industry, each having its own process technology, market focus, user perception, etc. The domain of ancillary sectors include the material resource based management sector and pharma technology sector. The product industry domain is critically dependent upon these two sectors for its growth and even sustenance. The health insurance sector is yet another ancillary industry which is likely to have a major role to play in the future growth of Ayurveda healthcare service domain. It must be realized that all these sectors function as individual industrial activities and they are treated as such in the economic terms. While talking about the future growth potential of Ayurveda industry in general, it is imperative that all these sub-components will also need to have plans to grow in a commensurate manner. At the dawn of independence, all of us know the scope and reach of this national heritage of India were quite restricted. During those periods, it played a considerable role in extending healthcare support to vast segments of the rural population of our country. Yet, it did not have the pan Indian reach. The important thing is that the sector did not receive any official patronage from the national policymakers for several decades subsequent to independence. That is what really throttled the growth of Ayurveda in independent India for quite some time. And the enhanced official patronage given to the system of modern biomedicine naturally resulted in further marginalization of the healthcare practice of Ayurveda in general and stunted the growth potential of every branch of its academics. Okay, yeah, sorry. This is the general context in which the future prospects of Ayurveda will need to be projected. Even in this context, it may be useful to keep in mind some numbers pertaining to the current status of Ayurveda. These slides quote some numbers which are regularly across in the public domain. One problem with the industrial and commercial segments of Ayurvedic sector is the abuse of authenticated and absence of authenticated and reliable data pertaining to its national level operations. As a result, we have no option other than to be guided by these trade data that are available in public domain. To start with, we are often told that 80% of the population use traditional medicine for their healthcare needs. Even the World Health Organization has quoted this number, but the fact remains that it is not corroborated by any objective data. It appears to be a loosely repeated number and its veracity is doubtful. There are some other data which in fact conflict with these numbers. For example, the National Sample Survey of India has reported in 2016 that only about 10% of the Indian citizens resort to any Ayush systems of healthcare. This applies to both rural and urban populations of the country. Kerala is reputed to have a long history of authentic practice of classical Ayurveda, which is quite popular among its population. The Kerala Shastra Sahitya Parishad, a non-profit organization of good standing, in the survey of the state's health status done in 2011, has found that only 7% of the Keralites depend on Ayurveda. These two reports suggest that Ayurveda is not accessed by about 90% of the Indian population, and these findings are corroborated by other trade data also. The National Economic Segment Statement of the country before the COVID pandemic has reported that the modern medicine market is the size 2 lakh crores. Compared to that, Ayush market size is only 20,000 crores, which is just 10% of the modern pharma size. Similarly, the annual growth rate of Indian healthcare industry is reported to be 22%, whereas the annual growth rate of Ayurveda sector is not more than 5%. It is true that all these varied numbers may not be exactly comparable to each other in a point-to-point manner. However, they do generally indicate that the fact that even 75 years after India gained independence, the national healthcare heritage of Ayurveda has not really come to the mainstream healthcare scenario even in the country of its origin. The reasons for this predicament may be varied and complex. In any case, it is in the background of this situation that any vision statement about the future growth of Ayurveda industry could be made. Taking into account the emerging healthcare needs of the country and also the present status of the Ayurveda healthcare system, we may make a vision statement that the healthcare capabilities of Ayurveda should become accessible and affordable to at least 30% of the Indian citizens by 2047, when the country will be celebrating the centenary of its independence. 30% may seem to be rather a meager percentage for many, but what we must realize is that presently it's only 10% as per the official records, and that in another 25 years it needs to go up by another 15%, which actually means a 2.5 time jump from the current level of 14 crores people to 35 crores people. Looking at our track record, it is not going to be a main achievement if we manage to reach that level. In order to achieve the objective, there is a need for overall improvement and growth in all segments of Ayurveda. Let us take a look at some of the components which will contribute to the envisaged growth. There are about 3,900 hospitals corresponding to 61,000 bed capacity, and are about 30,000 dispensaries spread across the country providing Ayush healthcare service. About 70% of them provide Ayurveda care. and are about 3.7 lakhs registered Ayurvedic practitioners serving the country. This works about 50 practitioners per 1 lakh of citizens. The interesting fact is that during the 10 years, last 10 years, the period from 2011 to 2021, there has been a reduction of about 9% in this number. These numbers will have to be more, these numbers will have to be more than doubled in the next 25 years. It may be mentioned here that there is a little more than 400 teaching centers for Ayush with a capacity to admit 29,083 undergraduate students and 143 centers with a capacity to admit 5,014 PG students. This training capacity will necessarily be to be enhanced. Similar is the case in the availability of medicines. The earlier quoted value of rupees 20,000 crore of Ayush product market comprises many entities. The medicines meant for treatment will not be more than 50% of that quoted amount. Will have to necessarily increase multifold for catering to the increasing number of patients. There are about 7,000 Ayurveda drug manufacturing units in the country in 2021. There seem to be some core issues which render Ayurvedic manufacturing activity unviable. The number of units came down by about 9% during the last 1 decade. The situation has to change drastically for the overall growth of Ayurveda. One major issue is the difficulty in ensuring uninterrupted availability of raw materials of the right quality in the right quantity. The government may have to intervene in this regard in a major fashion through its arm of NMPB. Further, new research and new technology would be required for improving the cost of effectiveness of the drug manufacture in order to enhance the affordability factor. The present consideration excludes for the exports. There is an urgent need to empower both the product and service sectors of Ayurveda in order to equip them to meet global standards. The newly instituted Export Promotion Council for Ayush is a firm step in this direction. Even within India, the various regulatory agencies need to be sensitized in a manner suitable for the seamless growth of Ayurveda. And most significantly, the government needs to embark on a major program to spread awareness among the various segments of the society about the healthcare capabilities of Ayurveda. Presently, Ayurveda seems to operate within a rather hostile environment. It is gratifying to note that there have been new governmental initiatives in the recent times in this regard, encouraging health insurance sector to expand the reach of their coverage on Ayurveda will make Ayurveda acceptable to a special groups. In short, there is a need for all the stakeholders, including professionals, protagonists, scholars, researchers, institutions, drug sector, and the government to come together and plan for concerted efforts in order to achieve the objective of rendering Ayurveda accessible to larger segments of the society. And I feel confident that this Dhara event will mark the beginning of such an effort. Thank you. Yes.
Thank you so much, sir.
Yeah.
It's an honor to have you here, and as a token of our love, thank you. Thank you.